Thanks, Stephen. Now, Parkinson's disease affects about 9,000 people in Ireland and can have a huge impact on the lives of those who are diagnosed with this progressive disorder.
World Parkinson's Day aims to raise awareness of the disease, and to mark it, today we're joined by consultant physician Dr. Graham Hughes and Declan Moriarty, who was diagnosed with Parkinson's at the age of 50. Good morning to you both.
You're welcome both.
Declan, can I be very ungallant and ask you what age you are now?
I am now 60 in July.
So you've been dealing with this for 10 years?
10 years, yeah.
And now, I wouldn't know. If you hadn't told us, I wouldn't have known that you had the condition at all. But then you have DBS.
I had surgery in 2011.
So how different is your life before and after DBS?
Well, the response that I make to that always is I'm 95% better than I was, before the surgery.
Declan, do you mind if we go back to the beginning of when you first noticed yourself starting to slow down? Because you were initially diagnosed with chronic arthritis and you felt that wasn't right.
Yeah, well, my body went stiff. I went on holidays to Canada and I couldn't walk anywhere. So when I came home, GP sent me to a rheumatologist and they told me I was riddled with arthritis. So I took the painkillers even though I hadn't got much pain and tried to keep it going. But eventually I had a little shake in my hand in the mornings, especially when I was shaving, and I presented that to the rheumatologist, and eventually they sent me into a neurologist, David Moorhouse in the Bon Secure Hospital, and within 10 minutes he told me you have Parkinson's.
And what did that mean to you when you heard Parkinson's? I mean, how aware were you as to what Parkinson's was and how it would affect you?
Yeah, Frank Williams, a guard, lived near us in Finglas, and he had shaky head Parkinson's before they could control it very well. And my grandfather had it apparently, I believe him. When I remember it now, but I was reminded of it then.
So it must have been deeply upsetting when you were told you had Parkinson's?
Yeah, it takes the bottom out of your world, because you look forward and you say, this is progressive. And when you go to a meeting, you see people who are worse than you, and say, I'm going to be there. And that's the sort of the...
So before, how far had it progressed before you had the DBS?
Well, I was stuck in chair at home very often for 3 hours, or wasn't able to respond to anybody, and felt very, very depressed in a way.
You're very isolated.
Yeah, because I had a rigid form of Parkinson's. So before the surgery I was just stuck very often for a good bit of the day.
How did people's attitude to you change?
People's attitude, well, some people are very nice, but some people couldn't take the disease. I mean, it's almost, we look at it, if I associate in some ways, I might become bad myself in some. Did
they feel that you were mentally deteriorating as well?
They weren't able to handle this. They weren't able to handle Parkinson's in me, I think. And one of my friends said he couldn't even talk about it. Because they'd known me so. They'd known me when I was moving.
You were a parish priest, so people were familiar with you standing up there speaking.
Yeah, absolutely, and I was in full flow. Yeah. And next thing I couldn't move, Okay. So it happened very suddenly in a way.
Let's talk about the DBS, which is deep brain stimulation. Now, there's a remarkable woman called Anne Keelty, who sat in exactly the same place as you, and she did one of the bravest things we've ever seen in the 14 years of this programme. She switched it off at the start of the interview.
Somebody described to me recently your face at the time you were.
Well, we were all struck by. I mean, it was so brave. She exposed herself.
It was a very generous act.
It was extraordinary, and it was also deeply upsetting to watch what happened to her.
Yes.
So this deep brain stimulation. So you've had an operation and you have a power pack in your chest.
I have a power pack in my chest and I have 2 pins in my brain wired to the power pack.
And this does what?
I have a gadget outside. Well, the voltage to the brain, and it is. Well, Graham might.
I might bring the doctor in here for the science bit. Actually, no offence, Declan.
No.
Can you explain? Well, first of all, what Parkinson's does to the body, and what DBS does to control that to a degree.
Yeah, what Parkinson's does to the body are the kind of symptoms that Declan was talking about earlier. He would have slowed up, he would have been rigid, performing the usual chores he would have done through the day, the things associated with his job or the activities he would like to do. He would struggle more with those, and people thinking that it's perhaps joint disease or arthritis is very common until you actually, you're assessed by someone who's knowledgeable in the condition. The treatment approach to Parkinson's, the surgery is part of it, but we try and take a much more holistic approach to it now. And most of it is very much around trying to encourage the person to self-manage their condition. look at the education of the person in the first instance. Declan alluded there to how the bottom fell out of his world. So there's a knowledge that this is a progressive disorder that will have different symptoms at different times, but it's unpredictable. So you can see an individual waiting in the clinic and say, gosh, am I going to end up like that? And there's a lot of fear with that. So the surgery is one part of it.
What does the surgery actually do, and how does it work, Graham?
It interferes with the electrical signals that one part of the brain is giving the other. So it balances those out, so that the excessive signals that are going to parts of the brain are removed, and the tremor and the stiffness abolishes.
It does make an amazing difference, doesn't it?
Well, it can do, yeah.
Graham, one of the things I understand about Parkinson's is that it is due to a diminution or a lack of dopamine.
That's
now,
right,
dopamine can be administered. So is that not a form of therapy, or would it?
It is a form of therapy.
Can we not replace it?
That's the mainstay of treatment that we have. So
all right, okay.
If you look at the vast majority of people who will come through our service are on oral medication or patch medication, or when the disease becomes more advanced, infusion-based treatment. That's dopamine replacement therapy. And it's not a cure for the illness, but what it does is it relieves many of the symptoms and signs of the illness so that people can function more independently and can have a better quality of life. And that's the focus of the medical-based treatments for it.
Okay.
And Declan, I mean, as Mark said, chatting to you, you would have no idea that you have Parkinson's, and that's as a result of the surgery.
Well, that's a result of the surgery, but I also take 22 tablets per day.
22 tablets
22 tablets a day. So
wow.
every 3 hours I take my medication.
This would be dopamine.
Yes. So dopamine
Replacement treatment, levodopa.
So I mean, in 3 hours, if you saw me in 3 hours, if I didn't take that medication, the DBS wouldn't hold me up.
Okay, so it's a combination of everything together.
It's a marriage between the drug therapy and then the DBS.
And your attitude and your outlook and how you approach it yourself, I'd imagine.
Well, absolutely. I mean, because as Graham was talking earlier before, the Parkinson's and depression are sort of,
understandably
together,
Yeah.
And so you have to pass through that in a sense and get
which you've
get
done.
beyond that.
That's very much where the organisations are very important. The
Yeah,
Parkinson's Association of Ireland, Move for Parkinson's. They allow people to have a forum where they can go and be informed and be educated around their condition.
Yeah.
They're a support service for each other, the membership supporting each other in that way, as well as advocating for improvements in the healthcare that we try and give across
So Parkinson's Association
patients.
Ireland is where people should turn to.
Absolutely,
Okay.
I suppose the message we're trying to get across today is that this is Parkinson's Awareness Day, and that people should try to maybe to embrace their condition. Some people sort of try to push it away and deny that it's so that they won't get any worse.
But it's not going anywhere.
It's not going anywhere.
Yeah.
Okay, today,
Declan,
April the
thank you so
11th,
much.
and the reason for it is because it's the birthday of the surgeon who actually discovered it, James
That's
Parkinson.
right, yeah.
Thank you very much indeed.
Okay.
Thank you, Doctor, and thank you,
Thank you.
Declan.
Thank you.
Right, let's go over to Stephen now for the news.